Hey everyone, welcome back to my channel. So today is a very special video because we are having another Kenhub giveaway, guys. This time we have 5 winners of a premium subscription for free for a whole month. I'm gonna be doing anatomy questions with you guys, incorporating Kenhub. And I'm gonna show you guys how to sign up to this giveaway by the end of the video. And I'm gonna announce the winners on my Instagram. So let's get started. Got some anatomy questions from Ambas for you guys. So let's see how we can incorporate Kenhub in our studying. So a 25-year-old man is brought to the ER 30 minutes after he was involved in a motorcycle collision. He was not wearing a helmet. So obviously this is like head injury, for example, like I'm anticipating. Physical exam shows left periorbital ecchymosis, which indicates there could be fracture. A CT scan the head indeed shows a fracture of the greater wing of the left sphenoid bone with compression the left superior orbital fissure. Now the clue here, guys, in this question is the superior orbital fissure, because this question needs you to know the structures going through this anatomical foramen in order to find out what the patient might complain of. So physical exam, this patient is most likely to show which of the following findings. Is it decreased sense of smell, which would be of the olfactory nerve, or numbness of the left cheek, which would be of the maxillary nerve? This needs you to know the structures going through the superior orbital fissure, guys. So I'm going to go to Kenhub and I'm going to find out. Let's see. So for example, I'm gonna write down here, guys, the superior orbital fissure. Here he's showing you the superior and inferior orbital fissure, and he's showing you the contents. There's obviously a video here, you can watch it all you want, you can quiz yourself, but I like to show you guys what's going through the superior orbital fissure, which is all the way down here. So you got the lacrimal nerve, the frontal nerve, trochlear, the oculomotor, and the ophthalmic nerve is very important here. The ophthalmic nerve, guys, that gives sensation to the eyeball. All right. And so I'm going to choose absent left corneal reflex, because we know that the afferent innervation of the corneal reflex is the cornea is supplied by the ophthalmic nerve, and the efferent, which closes the eye, would be the facial nerve, right? Now, if you want to check the other choices, for example, complete loss of vision would be on the optic nerve, and the optic nerve doesn't go through the superior orbital fissure. If you check here, guys, this is the optic canal, and here is where the optic nerve is. It has nothing to do with the superior orbital fissure, which is right here. And the inferior orbital fissure has the infraorbital nerve, which gives sensation to the cheeks. And so we're going to exclude numbness of the left cheek. We're going to exclude it because the nerve that supplies the left cheek goes through the inferior orbital fissure, not the superior, right? Decreased sense of smell. We know the olfactory nerve goes through the cribriform plate of ethmoid, and you can check this as well. Here, guys, it's showing you even a better picture of, this is the optic nerve in the optic canal with the ophthalmic artery, and then here are the contents of the superior orbital fissure one by one, and one of them is the ophthalmic nerve. All right, guys, and the inferior orbital fissure right here, you're gonna see that this nerve is the infraorbital nerve, and this one supplies the sensation to the cheeks, right? I wanted to show you guys that Kenhub started adding radiology and histology, so it's not just for anatomy. So here, for instance, you can choose, based on the region, and you can choose radiological anatomy, and I think this is very useful for USMLE questions. you know how to read brain MRI, how to read the CT, and especially the abdomen and pelvis. I think a lot of questions, um, rely on you knowing the orientation of and the level of this CT section. And he's showing you with overlays here. This is the liver, for instance. I think this will be very useful with the USMLE, in particular the radiological anatomy, right? And the histology, maybe for basic science or step 1, he's gonna show you guys by system. Let's say the female repro, and I told you guys before that this was high yield, the histopathology of the female repro. And so I think it will be useful if you know the normal first before, so you can recognize what's abnormal. So here you guys have the histology of the ovaries, and it's highlighting here everything. I think this will also be useful. You also have fetal tissues, so it's not just adults. So yeah, I just wanted to let you know that there is radiology and there is cross sections. I think this is very useful, especially that the cross sections are cadaveric. So this is something in addition to the anatomy. All right, next question. Let's see. A 72-year-old man comes to the physician for a 5-month history of hoarseness, exertional dyspnea, and fatigue. Now, guys, I want to give you a clue here that when you see something within months, taking place within months in an elderly patient, it's most likely neoplastic, If it's within years, it's most likely benign. If it's within days to weeks, most likely, inflammatory. This is just a clue here. He does not smoke or drink alcohol. His pulse is irregular, which means AF. Now, this is very important here. His voice is coarse in quality, so we have noticed this hoarseness. Physical exam shows a liver span of 16 centimeters, enlarged liver, and a soft diastolic murmur heard best at the apex. Now, what is this murmur? This, guys, is the murmur of mitral stenosis. It's diastolic because during diastole, we're supposed to fill. When it's stenotic, it's always going to make noise, which is a murmur, because it can't fill properly through the narrow valve. Now, at the apex is mitral. Which of the following is the most likely cause this patient's hoarseness? Okay, guys, this is a kind of a difficult question, but I want you guys to note that he has mitral stenosis, and this has probably enlarged his heart or left atrium, and therefore has got to do with the anatomy of this region. If you guys check the anatomy of this region, let's say here is the heart, for example, how does this have to do with hoarseness? If you take a look more closely, you will see that the recurrent laryngeal nerve on the left side hooks around the arch aorta. And this is very near the left atrium. If you notice my mouse here, it's very near the left atrium, which means if the left atrium is enlarged, it can impinge on the recurrent laryngeal nerve, which supplies the larynx. And here's how you can see here the nerve highlighted in green going to the laryngeal muscles. And so impingement on the nerve or its irritation can affect voice quality, right? Now, this is the correct answer, but I'm going to tell you guys why the other answers are incorrect. For example, carcinoma arising from the mucosa of the larynx. Okay, so carcinoma could be consistent with this history, but he does not smoke or drink, which is unusual. It's unusual that carcinoma, laryngeal cancer will come in someone who doesn't smoke or drink. Plus, he doesn't have weight loss or any local symptoms of pain, for instance, especially that he has exertional dyspnea and fatigue, meaning that he has heart problem, right? Bacterial infection, the vocal folds wouldn't persist for 5 months, he wouldn't seek medical attention. Plus, he doesn't have fever, right? Alright guys, now to the special moment. I'm gonna announce guys how to sign up to the Kenhub giveaway. We have 5 winners this time, so you have a very good chance. First, you need to like this video, comment down below what anatomical region you found most fascinating when studying anatomy, and leave your email in the Google form in the description so I can send you in case you win. And don't forget guys that even if you don't win, I still have a 10% discount link you can use on any subscription you have for Kenhub. So all the best to you guys.